Sweet. All right, let me
I've
hit
started the
OK.
recording.
So, hi everyone. If you didn't hear, I was telling my team that I can't see your faces. So, if you can either unmute if you have a question, or you can raise your hand, or you can put it in the chat box, or you can tag any person on the call and ask them. So, those of you joining today should be the family support programs, the evaluations that we were sent out to you. Um, you should have gotten them about a week ago, and so. You're probably familiar with this format, but we first kind of go through some sample, like how to read the tables and how to read the report, and then we'll have some time at the end for breakout rooms. So I won't take the time right now. I think you know most of my team, but Emily Rader might be a new face for you because she's been working on this project as a contractor with Michaela stepping back. So this year's process, the reports do look a little bit different. The time frame is July 1, 2020 through June 30th. I realized that last year's report had two of those years. The Crime Commission asked us to do some trend analysis, so that's why we went with the whole 3 years. We included programs that had been funded during this time, but there, you might see as well, you might see that some years were not funded. So we tried to give a comprehensive view if you had any referrals and enrollments during this time frame under community-based aid. As you know, we get the data from the Crime Commission. They match the subsequent law violations and probation and detention data, and then, excuse me, we analyze that data. The goal of this is really so, like bringing all of you together in communities of practice is really so we can have some rich discussion about like what does it mean to be effective as a family support program. And what does it mean if you're coming in every year as inconclusive or ineffective? And so the goal of that really is to improve all of our programs across the state, not to jeopardize any one program. So that's our why, right? Those of you who know me know I absolutely love program evaluation. It's really designed to kind of give you one step further every time so you can improve. So if you see something in your report that doesn't make sense, absolutely stop and ask us because you can't improve if you don't understand the results. The other thing is the reports this cycle you'll see some different layouts coming up if you have other programs, but what we've tried to do is include some statistical analysis. And the reason for that is because we can give straight demographic data and it doesn't tell you whether or not something's really happening. Even though sometimes it's intuitive, like if 50% of your kids don't enroll, there's probably something going on there. But we've tried, if you have enough cases, we've tried to do some or some statistical analysis, and that would really help you hone in on what's effective and what's not effective. So pay attention to that when you look at your individual program reports. They're really designed to be useful to you and your program. They really don't go anywhere if except for to you and like whoever you release it to. Occasionally, we'll see programs that are such a good example of kind of implementation science that will call you up and say, "Can we use your report?" But otherwise, the Crime Commission sees them and you see them, and the team at JGI. So they really are designed to help you and your staff examine ways that you can improve your service or your intervention. Specifically, pay attention if there's specific populations that you see are not reaching sufficiently. That would be something really to pay attention to. I just gave the example if 50% of the youth referred to your program don't enroll, that's kind of a sit up and take notice moment. But also, if those youth were all one demographic, if they were all women, if they were all African American youth, if they were all 10-year-olds, right? So paying attention to who it is. Sometimes that data is not included in the report, so we can either work with you or you can ask for those cases and we can give you the profile ID because we don't get names. So we can help you dig in if you want to dig in. Um, so the ultimate question, like I just reviewed the statute like last night, and ultimately JJI is charged with measuring whether or not a program is effective. So for each program type, there's a specific aim, right? So truancy programs have a goal of getting kids to school better. Versus family support, we're really looking at improving family communication and overall family functioning. So to answer that question, like we have to have enough cases to say something about that. Typically, we tried to say closing out at least 80% of your cases, but having more than 10 cases. Um, so we want sufficient enough data in to answer those questions, basically. Now, there are some questions that are the same, or some measures that are the same across all community-based aid-funded programs, and those are set in statute. You're probably really familiar with these, but they're basically our recidivism or future system involvement measures. So, regardless of what kind of program you run, you in the final pages of your report, you should see an analysis of which youth went on to get a status offense, a law violation, probation, or detention. So for status offenses and law offenses, we cap it at 1 year post completing your program. So if a youth completed your program January 1, 2024, we only look through January 1, 2025. Probation and detention, however, are longer measures, and those are pretty much open endlessly. Like when we pull the data, if the youth had ever been adjudicated to probation or placed in detention. So that's a longer window of time. They're just different ways to measure recidivism, basically. And then what we did this year, oh, I didn't include it here. You'll see, I think it's included in one of the slides when you get your report. We tried to break it down because we're really curious, like youth who are successful, do they have better outcomes than youth that are not successful or never enroll in your program? Because we should theoretically see some difference in those populations. So I'll pause for a minute and if there's any questions, otherwise I'll get into kind of reading your report and how to go about that. Okay, I can't see any hands, but somebody would tell me, right, if there are hands or questions?
I don't see any questions.
Okay, thanks, Emily.
Yeah.
So when you get your report, the slides you're looking at are they're genericized. We've taken out like no one program is going to be visible for everybody, and that's very intentional. So when you see County X, we know there's no County X. This is just as an example. Um, so again, looking at the same time frame, July 2020 through 2023, what we tried to do is take on this side of the column, we're looking at the population in your county, and this is your program's population. So in this example, and then we try to write up a narrative. So if you're like, what does this chart mean? We tried to write it up. But if you still are like, this doesn't make sense, make sure you get into a breakout room and we talk about it. But in this program, you can see in this county, in County X, 5% of the population was Black, but the program's serving 27% in their program. So it's just like that's not, it's just a process variable for you to pay attention to, but there's no scoring based on this at all. I know last year we looked, there were points assigned if you were matched or targeting a certain population. We were asked not to do that this year, so this is just descriptive. We're just telling you what we see. And you can see the white population in this county is 71%, and the program's serving about 33%. So it's just one of those, like, something you should know about your program. If that's not intentional, you should ask yourself why that's happening. But in most programs, they know this already. So this tends to not be a surprise. Then you should see a chart that looks like this. It's a little less exciting when there's very few cases, but in this particular example, out of 335 youth, you can see they're enrolling. So the blue is how many were enrolled. They're only enrolling 41% of the youth. So this should be something to kind of pay attention to, like what's going on that we are having a lower enrollment rate. And then what we tried to do is break it down by racial groups, racial and ethnic groups, to see which youth are the least likely to enroll. Now, this can help you if you're aiming for a certain population, it can help you target that population, or it can just be information that you can change your practice. So I gave this example a couple of years ago, not a couple of years ago, a long, long time ago. I used to run a diversion program, and we noticed that youth from a certain zip code were not enrolling. So we targeted that. We sent people to the houses to say, "Will you enroll in diversion?" And it increased their enrollment. So that's exactly. We try to narrate it in the box in case you're like, I don't even want to look at a chart. Then we tried to just use words. And again, if it doesn't make sense to you, make sure and stop us and ask, like, what's going on here? So, Another chart that you will see that's different this year is again just meant to be really just a graphical display of what's happening. So these are broken down by your fiscal years. And so what we're looking for is, has the program had consistent referrals across time? Are there certain months, like in this particular example, July 2021 seems to be the high point. The other thing to watch for in this grant is the black line is the kids enrolled, and the white spaces are when there wasn't an enrollment. Um, did I say that right? The black youth is youth referred, and then the white spaces are if a youth didn't enroll. So when you see these spaces, you're like, oh, I mean, there's nothing super outstanding here. The biggest gap is probably March of 2021. It seems like there were some programs that, or some youth that didn't get enrolled. So if I was a program, I'd be thinking about this like, it looks like I have consistent referrals. I don't know what happened right here. Maybe my staff were out on vacation, or we didn't have a timely follow through, or I was down a staff. Like all of those things could contribute. Or you'll see another place on your report that shows the reasons youth didn't participate. So really kind of paying attention to when youth are referred, who becomes enrolled and who engages and participates in the program. Um, the other thing you might see is if you have like a total like flat line on one of these, it might be that your program didn't get funding that year or referrals died off. So those are all things to just pay attention to. You're probably super aware of that if your program didn't get referrals, say in 2022, 2023. Um, but it's something to just make note of and decide how to move forward. Like maybe you're no longer offering this program in your county. We then look at the same kind of enrollment trends by racial group. Again, this is to help programs if they're seeing a group, like right here, we see white non-Hispanic. Even though it's consistent, it's a few cases every month. There's no spike versus when you get here to July of 2022, we see a real spike. And same for Black youth, but it's a different month. So just starting to pay attention to kind of referral programs or referrals and enrollment, and what does that mean for your program? The next area we look at is outcomes. And so in this, these are the measures that are very specific to family support programs. These are not, no other programs have these specific types of outcomes. So we're looking at both family function and family communication. And so when you look at this, you may see like these are fairly small changes here, but this is a good example of you should see, I can't get to the bottom of the page, you should see a footnote and it'll tell you whether those are statistically significant. So sometimes a change looks pretty minor, like 3.5 to 3 to or 2.5 to 3, you might think, well, that's small. But depending on the number of cases you have, you might be making a significant change in family functioning. And the same thing for family communication. So those are the two measures that we're really looking for in outcomes for family support programs. The other thing that we look at, we do look at who is successfully discharges from your program, and we try to do that by race. And you can see the light blue is successful, the dark blue is unsuccessful, and then you have some cases that are other. And we break them down that way because ultimately a program might not have much control if a family moves away, for example. Right? That's closed out as other, and you can't change that outcome. I'm trying to think of the word static versus dynamic. So what we're looking for is on the cases that you could do something about it, what percent of those cases? So in this example of the 335 cases, we're seeing some interesting things here. 62% here are showing up that they did not participate in this example. That's a really important finding because there's something about the whole process then that families are not engaging. And that might be time of the day. It might be, they're required to go to too many classes, or it might be just the way it's structured. It's not something that works into a busy family's life. So these are the kind of things like these gray bars are, I tend to really pay attention to programs that are um, findings where youth are not engaging or not participating. Because ideally, we want to see big chunks of blue in this area, right? Across all racial groups. Um, the other thing to just note is um, these categories. If you're like, what do these letters mean? At the bottom of your page, it should tell you, but this is non-Hispanic Pacific Islander. You'll also notice that it was only 4 cases. So when you have really small numbers, take that with a grain of salt. Versus if you have like 30, 40, 50 cases, 61, those are more meaningful findings, or 300 plus cases. So in this particular case, Asian and non-Hispanic and Hispanic, there's some differences there, but it's really amounts to one youth. So just pay attention for that you should see in a bracket the number of cases. And then finally, I think we're getting close to the end of the sample reports. So you should see future system involvement. And how we broke these apart this year is we looked at all the kids who were referred to your program and engaged. And then we looked at youth who successfully completed your program and then youth who were unsuccessful in your, for whatever reason, they did not successfully complete the program. So what you can see right away here is that 13% of the successful cases, I'll start with overall. Overall, 14% of youth who were in your program had some type of future system involvement. So when you look at this, you can see one had a status violation, there were 18 law violations, there were 22 probation adjudications, and then 9 youth in detention. The way we get the data, this isn't one youth, and it's not 18 youth. It could be there was probably one youth that had a status violation, but these 18 law violations could be duplicated with kids who were also on probation. So this is just overall, how many times did that kid touch that part of the system? And again, this is all the youth who came through the program. So it gives you kind of a baseline comparison. And then we look at kids who are successful compared to kids who are unsuccessful. And so in this example, what you'll see is that kids who are successful have a lower percentage or a lower rate of getting involved with some type of law violation in the future and a lower rate of, sorry, this sample doesn't make sense to me. Oh, I know what it is, I think. Either this is a sample or there's something off. So there's in the unsuccessful kids, one thing to pay attention to again is those small numbers. So even though it's a higher percentage, it's 43%, we're really talking about 3 kids. So just always take it with a grain of salt when you have those small numbers because it drives the percent up. And there's the 3, law violation, probation, and detention. So then the last thing before we get into kind of the write-up and the matrix is we also looked at youth who do have a subsequent law violation. How many days does it take them to get that new law violation? So I take this, this always triggers me. I had a kid when I was running a diversion program. He walked out the door and shoplifted while he was still in the program. So we don't count those because those might be counted as like the way you close the case, especially with certain types of programs. So what we try to do is look at really, truly, 35, 40 days after a youth completes your program, then do they get a subsequent law violation or end up on probation? And we look at the number of days for successful youth compared to unsuccessful youth. Now, we only do this and we only look to see if it's statistically significant if we have enough cases. So if you have a really small program, you might not see all of this rich, interesting data. So I'm sorry about that. But anything, like when you base something on 2 cases or 3 cases, it's really not a solid finding. So we try not to do that. But okay, sorry, I just rolled through something. So as I mentioned at the beginning, you just looked at some process variables like who's enrolled, who's referred. You're not rated on those. We're really this year only rating on these measures of effectiveness. Those are really just for your benefit, and so your program can determine, am I enrolling the right population or the group of kids that need this service? So how we determine effectiveness. Last year we used a similar evaluation matrix, but this year it's a little bit more complicated. I'll give you that. And we worked with the Crime Commission to set these scoring. We first went to the literature and we were like, okay, what should a family support program be able to do according to the research? And ideally, a family support program is going to help the family with their family functioning overall and then their communication. So you can see if cases closed and had no change or got worse from intake to discharge, that you actually can get negative points this year. Versus if there was just simply nothing statistically significant, there was just no change intake to discharge, you would get no points. And then if you're seeing change and it's statistically significant, you're getting a +5. So we do that for the two measures that are pertinent to family support. And then you'll see that, oops, the family support or the future system involvement that is straight from the statute. Now, in this particular example, it's grayed out because we did not have 10 cases. Um, in the first, or that line 3 that I'm pointing to, I keep clicking, I'm sorry. If we don't have 10 successful and 10 unsuccessful, we don't have a good comparison group. So that might be grayed out, and then it doesn't score against you or for you. Either way, it's just off the chart. And then the same thing for overall future system involvement. Sometimes certain types of programs we don't see a lot of subsequent law violations. Um, Again, to score in this higher range, we're looking to see change, but also a statistically significant change because that tells you something's really happening. It doesn't tell you what's happening, right? It might be that you have two phenomenal staff, or it might be that that year you've got referred youth that were just more amenable. So it doesn't tell you exactly why you're successful, but it does tell you that something's happening when it's statistically significant. So I'm going to take a breather in just 1 second. Um, so you should also see a chart at the bottom. In this, the ranges are no effect, promising, and effective. And you can see basically it's kind of unusual because really anything above 1% is you're getting into a promising range. And that's really what we're looking for. We just don't we don't want to see a program that's actually having worse outcomes, right? Because that's when you get into the no effect and some negative numbers. But again, if you just have small numbers, it's either if your numbers are super small across the board, you would be rated as inconclusive, like we wouldn't fill this out at all. Or if you're just have too few cases, we only score you on the things that you have data for. So that should all be spelled out pretty clearly in the narrative description. Like questions like, are you serving the correct population? Are you hitting targets? Are you successfully closing cases? Are you reducing or changing future system involvement? And then we try to put a few recommendations at the bottom, but it's always hard. Like, programs know their program the best. So I always feel a little uncomfortable when I'm like, you should do this. So if you got an email or if you got a comment in there that, you know, made you steamed, just tell me because I sometimes we don't know the exact population that you're working with because we don't have all of those variables. So definitely talk through it with us. And then just if you have other programs coming up, I alluded to this. So this is kind of our whole evaluation webinar schedule. We're right here on March 26th. So if you're involved in mental health programs or truancy or diversion, those are all coming up. And we hope to be doing diversion and prevention and promotion at the community-based aid conference so we can do these in person. I think it's, yeah, June 13th. So hopefully that will work out. So what we generally do now is we go into one-to-one breakout rooms where you can have a minute to talk to either one of the researchers, and then we'll also have a staff in there taking notes, so you can ask any questions or if something looks off to you. So we try to do that in kind of a more private setting, and then we will ask you if you have a minute to take a minute to do a survey while you're waiting. Typically, we try to do these in, with just a few minutes. Like you're not obligated to meet with us if you're like, I don't want to. You don't need to. But if you do want to meet, just be patient because if there's two people or two programs ahead of you, it could take 20 minutes. So we try to keep you posted on how long it'll take. So I'm going to stop sharing. Oh, wait, I have one more. If you have any questions, reach out to us. This UNO JJI email is probably the best because it gets routed to whoever the question is most relevant for. So please jot that one down. And if you're not sticking around, please try to take the survey. It's really helpful. In the survey, you can say like, "I hate this report this year," or you can say, "This is great." Whatever whatever feedback you have is really helpful to us because we are making changes to this, as we go. So I will stop and see. First of all, are there any questions just generally in the report? Thanks, Faith. I see Faith put the link for the survey in there. Now I can see the chat box. Are there any questions just generically about these reports? If not, then I will have Faith